Welcome back. This is Dr. Monte with Rehab. I wanted to talk a little bit about what to expect when you're expecting your first visit at physical therapy. So, when you get an injury or maybe post-surgical or whatever reason you're going to see a physical therapist, the first visit, don't be surprised if they hand you paperwork because it's the medical field. Everybody's got paperwork or some kind of digital forms that you need to fill out. And so be patient, don't shoot the messenger, you have to fill it out again. So once you get all that done, then the physical therapist will bring you back to the back office and do an examination. Okay, the examination will pretty much take anywhere between 20 minutes to an hour, depending upon the level of skill level of the therapist and the injury or the reason you're there, how in-depth and entailed that injury is. Oftentimes, in my own practice, this may be different with every therapist, but oftentimes what I've seen is during that first visit, you go through the examination, and then you'll get a little bit of treatment, and hopefully, possibly, if appropriate, a home exercise program to get you running, all right, get you started doing something for yourself. The other things to expect is more than likely some pain. You may hurt a little bit more after the examination because we're poking and prodding, stretching, pulling, testing everything to try to understand what the cause of your pain is. Obviously, this is something that's not a post-surgical reason. Obviously, if you're going for a post-surgical, we know what the cause is. You had surgery. So we don't have to do all that poking, prodding, and stretching and whatnot to you. But if it's an injury and we want to try to get down and dirty with figuring out what the cause of it is, what's provoking your pain and problems, we need to do that thing. And sometimes that flares up some pain. So use your medication as you feel comfortable doing and as prescribed. Drink plenty of water and follow the instructions of the therapist. Do what you're asked by the physical therapist. You've got to put the work in to make the difference. All right? What you get from the therapist is direction. Oftentimes they can help relieve the pain, but if you're only seeing them once a week, you've got 6 other days to help yourself. So be motivated to do that. And then when you leave the therapy office, they'll get you back in on another appointment. But always come to therapy with any questions you might have. Write them down, because oftentimes you go into the doctor's office, you get caught up in what's going on and you forget to ask the questions. So write down your questions, write down your concerns, and just follow what your therapist prescribes for you at home. And more often than not, you're going to heal up just fine.